everyone, this is Dr. Meghan Karol. I hope you're doing well. Today we're going to be going over some spine and hip mobility exercises. And you might be thinking, why would I be doing that for my pelvic floor health? But the spine is all connected top to bottom. And so if you have very stiff upper spine or even your lower back, that can impact how your sacrum, how your pelvis is moving, therefore impacting those muscles connected to it. So the exercises we're going over today are going to be laying down. You can do them on your bed, on your couch, on the floor, whatever feels accessible to you and easy to do. So what I'm going to do is I'm going to go ahead and lay back on my back. These can even be great when you first wake up in the morning. You know how we're always so stiff, can barely move. Movement is a great way to just kind of get some joint lubrication, some blood flow to the muscles. So a lot of times I'll even go over this with my patients, just like before you even sit up and move, you know, do a few of these and see how that helps just loosen up those joints. So the first one that we're going to do for spinal flexion or bending the spine, you can just bring one knee up toward your chest. I prefer to hold behind the knee, especially if you have any knee issues and if you're pulling on that knee and putting all that compression there. So I prefer holding behind the knee and just taking nice deep breaths. If this feels too easy for you and you have the strength and the mobility, you can bring both legs up and hug it into the chest. Sometimes it even just feels good to move side to side or maybe even do a wide knee, whatever feels good to you and your body. The next thing we're going to do is just a nice rotation. So I'm simply going to let my knees go from side to side, and that sort of carries and twists my body with it, going from side to side. You can even add your head turning in the opposite direction of your knees as you go, coming up to center, turning your legs and knees, hips, and then letting your head go in that opposite direction. From there, we're actually going to do some rotation for the hips. I'm going to bring my feet nice and wide, probably like wider than my shoulders. And certainly if you're on your bed or your floor, you'll have more room. If you're on your couch, you might have a little bit less room. And then I'm going to let both knees kind of fall to the side, almost like that one knee is touching towards my foot. And then I'm going to bring and go to the opposite side. So I'm turning my hip inwards. I'm getting that internal rotation as well as external rotation. Both are equally important for your hips, for your body. Certainly you can even add your arms. So if you have the shoulder and chest mobility, you can do your arms overhead and then get that nice cross body stretch. Again, maybe even adding your head in with it to get your whole body involved. From there, if you have the mobility, you can bring one ankle up to your knee, and even from there, maybe kind of doing that knee up or down, just kind of getting that hip moving, doing that on both sides. And then I love this warm-up stretch, stretching all through the back of the leg. I'm gonna, again, hold behind my knee. I'm gonna kick my leg up straight, and then I just sort of pump my ankle up and down. So you have a big nerve, the sciatic nerve. It comes from the low back, sort of passes through the back of the butt muscles, and then all the way down the leg to the toes. Most people have heard the term sciatica, or my sciatic nerve is bothering me. So this lengthens and sort of flosses that nerve in between all of that tissue. So I like to just kind of hold it really gentle, kick up and down, maybe 3 or 4 times. I'm not a big counter. I just kind of go for what feels good for my body. And then I do usually make the joke, nerves are like prima donnas. The more you push them, the more they're going to push back. So I like to be really gentle and easy. So if you're really feeling flared up through that nerve, you might only be able to get to here and get that pump. And then maybe as you loosen up and warm up, you can go a little bit further. You don't have to force it and push it all the way. Okay. If you're able to lay on your stomach, you're just going to take your time rolling over onto your stomach and then simply laying like this, opening up through the front of the body, opening up through the hips, opening up, extending that back. If you're able to, do your whole arm straight. If that's too intense on your back, just keeping it on your elbows, maybe even putting a pillow underneath your chest to support yourself there. And then either laying down, or you can have yourself propped up on your elbows, just kick your butt. Just kind of stretching through the front of the thighs, the front of your hips, just opening up through the front of your body. I hope those are helpful for you. They're very easy, and even if you are super flexible, you can just use those as a morning warm-up exercise. I hope you have a wonderful time on your journey through your pelvic health, and I want you to just take your health in your hands and move forward with it every day.